Welcome back to CliniqueRN. Today we've got 30 high-yield pediatric NCLEX questions lined up. Perfect practice to sharpen your test day confidence. And if you find these helpful, remember our CliniqueRN NCLEX bank has even more pediatric sets just like this, with AI feedback, summary sheets, and a CAT system that feels just like the real exam. All right, let's jump straight in. Question 1. Growth and development, 9 months. A 9-month-old presence for a well baby check. Which finding needs evaluation? 1. Sits without support. 2. Uses immature pincer grasp. 3. Crawls on hands and knees. 4. Walks independently. The correct answer is 4. Walks independently. Rationales. 1. Normal at 8-9 months. 2. Normal to emerging 8 to 10 months. 3. Normal around 9 months. 4. Too early. Independent walking is 12-15 months. May signal abnormal tone or spasticity. Teaching point. No milestone red flags. Too early or late. CliniqueRN Test-Day Tip. When a choice is developmentally too advanced, it's often a red flag. Question 2. Airway, epiglottitis. A child with suspected epiglottitis is drooling, sitting forward, and anxious. Priority? 1. Inspect the throat with a tongue depressor. 2. Start an IV for antibiotics. 3. Prepare for controlled airway or intubation. 4. Offer sips of water. The correct answer is 3. Prepare for controlled airway or intubation. Rationales. 1. Never manipulate the throat. It can precipitate complete obstruction. 2. Important but airway first. 3. Best. Secure airway with an experienced provider present. 4. Oral intake risks aspiration. Avoid until the airway is secure. Teaching point. Keep the child calm. Avoid procedures that irritate the airway. CliniqueRN Test-Day Tip. Airway plus drooling plus tripod means get airway equipment now. Question 3. Cardiac. Tetralogy of Fallot. Tet spell. A 3-year-old with TOF becomes suddenly cyanotic while playing. First action. 1. Administer oxygen via nasal cannula. 2. Call the provider. 3. Place the child in the knee-chest position. 4. Give PO fluids. The correct answer is 3. Place child in knee-chest position. Rationales. 1. O2 helps, but the position rapidly raises SVR and improves shunt. 2. Call after immediate intervention. 3. Best initial, knee-chest to reduce right to left shunt. 4. PO fluids are non-urgent and unsafe during distress. Teaching point. Positioning can be life-saving before meds. CliniqueRN Test-Day Tip. For cyanotic spell, think knee-chest first. Question 4. Immunizations. Live vaccine contraindication. Which vaccine is contraindicated in a 4-month-old with severe combined immunodeficiency? 1. DTaP. 2. HIB. 3. IPV. 4. Rotavirus. The correct answer is 4. Rotavirus. Rationales. 1. Inactivated, safe. 2. Inactivated, safe. 3. Inactivated, safe. 4. Live oral vaccine. Contraindicated in severe immunodeficiency. Teaching point. Live equals MMR, varicella, rotavirus, and others. CliniqueRN Test-Day Tip. Immunocompromised plus live vaccine no. Question 5. Endocrine, hypoglycemia. A school-age child with T1DM is sweaty, shaky, and irritable. What's the best snack? 1. Peanut butter on whole grain toast. 2. Apple juice. 3. Cheese and crackers. 4. Turkey sandwich. The correct answer is 2. Apple juice. Rationales. 1. Slows absorption. Use after correction. 2. Rapid sugar correction occurs quickly. 3. Proteins or fat delays glucose rise. 4. Too slow. not immediate treatment. Teaching point: 15g fast carb, recheck in 15 minutes. CliniqueRN Test-Day Tip: cool and clammy, give them candy. Question 6. Dehydration, infant. An 8-month-old with vomiting/diarrhea. Which sign indicates moderate dehydration? 1. Bulging anterior fontanelle. 2. Sunken eyes and decreased tears. 3. Bounding pulses. 4. Generalized edema. The correct answer is 2. Sunken eyes and decreased tears. Rationales. 1. Bulging suggests ICP, not dehydration. 2. Classic dehydration signs. 3. Dehydration tachycardia with weak pulse. 4. Edema suggests fluid overload, nephrotic syndrome, etc. Teaching point: ORS is first line if able to drink. CliniqueRN Test-Day Tip: tears plus mucous membranes tell the truth in infants. Question 7. Pyloric stenosis, labs. A 4-week-old with projectile vomiting. Which expected ABG? 1. Metabolic acidosis, K. 2. Metabolic alkalosis, Cl. 3. Respiratory acidosis, CO2. 4. Respiratory alkalosis, CO2. The correct answer is 2. Metabolic alkalosis, Cl. Rationales. 1. Vomiting loses acid, not causes it. 2. Loss of H and Cl alkalosis plus hypochloremia. May have low K. 3 and 4. Not a primary respiratory problem. Teaching point: correct fluids/electrolytes before pyloromyotomy. CliniqueRN Test-Day Tip: vomiting stomach acid equate to alkalosis. Question 8. Intussusception, response to care. A toddler with intussusception is scheduled for an air enema. The child passes a large brown stool. Nurse action: 1. Proceed to radiology as planned. 2. Notify the provider to reassess/cancel. 3. Start NPO status. 4. Begin IV antibiotics. The correct answer is 2. Notify the provider to reassess/cancel. Rationales. 1. Passing normal stool may indicate spontaneous reduction. Reassess first. 2. Best. Update provider. Plan may change. 3. NPO is fine pre-procedure but not priority now. 4. Not routinely indicated. Teaching point: symptom resolution can change the plan. CliniqueRN Test-Day Tip: when the problem resolves, re-verify orders. Question 9. Cystic fibrosis, enzymes. Parent asks about pancreatic enzymes. Best instruction: 1. Give with meals and snacks. 2. Crush in a hot cereal. 3. Skip if the child eats high-fat food. 4. Store at room humidity unsealed. The correct answer is 1. Give with meals and snacks. Rationales. 2. Do not crush in terracotta beads. Heat destroys enzymes. 3. High-fat meals need most enzymes. 4. Moisture degrades. Follow storage instructions. Teaching point: add vitamins A, D, E, K. High-cal, high-protein diet. CliniqueRN Test-Day Tip: CF enzymes equals with every meal/snack. Question 10. Bronchiolitis, RSV. Which intervention is priority for an infant with RSV having poor feeds and copious secretions? 1. Routine bronchodilator treatments. 2. Cool mist humidifier only. 3. Nasal suctioning before feeds. 4. Prophylactic antibiotics. The correct answer is 3. Nasal suctioning before feeds. Rationales. 1. Bronchodilators are not routinely effective in RSV. 2. Helpful comfort measure, but not a priority. 3. The best option. Clears the airway to improve feeding/oxygenation. 4. Viral illness. Antibiotics not indicated. Teaching point: contact plus droplet precautions. Hydrate. CliniqueRN Test-Day Tip. In infants, suction is often the airway winner. Question 11. Meningitis. First action. Febrile child with nuchal rigidity. Meningitis suspected. First action. 1. Start broad-spectrum antibiotics immediately. 2. Obtain blood cultures, then start antibiotics. 3. Perform lumbar puncture before any treatment. 4. Give acetaminophen and observe. The correct answer is 2. Obtain blood cultures, then start antibiotics. Rationales. 1. Antibiotics are urgent, but get cultures first if no dangerous delay. 2. LP can follow stabilization and antibiotics if needed. 3. Antipyretic alone is insufficient. Teaching point, droplet isolation promptly. CliniqueRN Test-Day Tip. Cultures antibiotics, unless it delays care dangerously. Question 12. Kawasaki disease vaccines. Child received IVIG today for Kawasaki disease. Parent education. 1. Give live vaccines next week. 2. Avoid all vaccines for 2 years. 3. Defer live vaccines for 11 months. 4. No vaccines are needed now. The correct answer is 3. Defer live vaccines for 11 months. Rationales. 1. IVIG blunts response, too soon. 2. Overrestriction. Only live vaccines are delayed. 3. The correct option. Delay MMR/varicella 11 months. 4. Routine schedule continues for inactivated vaccines. Teaching point. Watch for coronary aneurysms. High-dose aspirin per protocol. CliniqueRN Test-Day Tip. IVIG today, live vaccines later. Question 13. Rheumatic fever prevention. A child had untreated strep throat 3 weeks ago and now has migratory joint pain. Key preventive measure. 1. Daily NSAIDs lifelong. 2. Monthly benzathine penicillin injections, white heavy checkmark. 3. Daily aspirin for 6 months. 4. No interventions needed after symptoms resolve. The correct answer is 2. Monthly benzathine penicillin injections. Rationales. 1 and 3. Not preventive for recurrence of strep. Aspirin use in children is cautious. 2. Secondary prophylaxis prevents recurrent rheumatic fever. 4. Recurrence risk remains. Needs prophylaxis. Teaching point. Carditis risk, long-term prophylaxis. CliniqueRN Test-Day Tip. Rheumatic fever? Think penicillin prophylaxis. Question 14. Hemophilia, joint bleed. A boy with hemophilia A has a swollen, painful knee after minor trauma. Best action. 1. Passive RUM exercises. 2. Apply heat. 3. Replace factor VIII and rice. 4. IM ketorolac for pain. The correct answer is 3. Replace factor VIII and rice. Rationales. 1. RUM can worsen bleeding acutely. 2. Heat increases bleeding. Avoid. 3. Standard. Factor replacement plus rest. Ice. Compression. Elevation. 4. IM injections and NSAIDs increase bleeding risk. Teaching point. Avoid IM injections. Use acetaminophen for pain. CliniqueRN Test-Day Tip. Painful joint in hemophilia equals hemarthrosis until proven otherwise. Question 15. Sickle cell, vaso-occlusive crisis. A teen with sickle cell has severe limb pain, 38.6 degrees Celsius, O2 sat 95%. Priority? 1. Apply ice packs to painful areas. 2. Start IV fluids and give opioid analgesia. 3. Restrict fluids to prevent overload. 4. Immediate antibiotics for fever. The correct answer is 2. Start IV fluids and give opioid analgesia. Rationales. 1. Cold causes vasoconstriction. Avoid. 2. Mainstay. Hydration plus opioids to relieve vaso-occlusion. 3. opposite of what's needed. 4. Fever prompts evaluation, but crisis pain and hydration are priority now. Teaching point, warmth, hydration, pain control, oxygen if hypoxic. CliniqueRN Test-Day Tip. Don't undertreat pain in sickle crisis.
All right, quick break, because I need to show you something that can actually change the way you study for the NCLEX. This is our AI feedback system, built right into the QBank dashboard. After every quiz, you don't just get a score. You get personalized insights that explain why you missed questions, where your weak spots are, and how to fix them. For example, it tells you things like which subject areas need urgent review, whether you're rushing through questions and leaving test time unused, step-by-step recommendations like taking focus quizzes to sharpen delegation, prioritization, or clinical judgment. Instead of just saying you scored 60%, it literally gives you a roadmap to improve. And that's just one part of the QBank. You'll also get challenging NCLEX-style questions that test real critical thinking, a clean summary sheet that tracks your progress over time, and a built-in computer adaptive test system so you can practice under real exam conditions. This isn't just question practice. It's smart, AI-driven coaching that helps you study smarter, not harder. If you're serious about passing the NCLEX on the first try, check the link in the description and start using the QBank today.
Question 16. Nephrotic syndrome care. A child with nephrotic syndrome has periorbital edema, plus 3 proteinuria, and albumin 1.8 g/dl. What is the best intervention? 1. Liberal fluids and sodium. 2. Albumin infusion followed by a diuretic. 3. Encourage live vaccines today. 4. No infection precautions needed. The correct answer is 2. Albumin infusion followed by diuretic. Rationales. 1. Restricts sodium/fluids with edema. 2. Restores intravascular volume, then diuresis. 3. Live vaccines are often deferred during immunosuppression/steroids. 4. Infection risk is high. Hand hygiene is essential. Teaching point, daily weights, monitor skin and edema. CliniqueRN Test-Day Tip. Low albumin means give albumin, then diuresis. Question 17. Acute otitis media, prevention. Which parent's statement needs correction? 1. I'll avoid bottle propping. 2. We'll keep up with pneumococcal and flu vaccines. 3. Secondhand smoke increases the risk. 4. We should stop all swimming permanently. The correct answer is 4. We should stop all swimming permanently. Rationales. 1 to 3. Correct prevention strategies. 4. Swimming isn't a blanket contraindication. That's more for otitis externa risk. Teaching point. Breastfeeding helps. Smoke avoidance matters. CliniqueRN Test-Day Tip. Vaccines PCV/flu. Lower AOM risk. Question 18. Lead poisoning. Toddler with a venous lead level of 18 g/dl. Best nurse action? 1. Start chelation immediately at home. 2. Identify and remove environmental sources. 3. No follow-up needed. Level is normal. 4. Give high-calcium foods to cure lead toxicity. The correct answer is 2. Identify and remove environmental sources. Rationales. 1. Chelation is typically for higher levels. Follow local thresholds. 2. Key intervention. Eliminate exposure. Paint/dust/soil. 3. Not normal. Needs education and follow-up. 4. Calcium helps reduce absorption but does not cure toxicity. Teaching point. Screen siblings. Wet mop. Don't dry vacuum dust. CliniqueRN Test-Day Tip. Address the source or levels will rebound. Question 19. Infant CPR basics. Single rescuer CPR for an unresponsive infant with no pulse. Correct compression method? 1. 2 thumbs encircling technique. 2. 1 hand on sternum. 3. 2 fingers at center of the chest. 4. Heel of one hand on lower sternum. The correct answer is 3. 2 fingers at center of chest. Rationales. 1. 2 thumb encircling is preferred for 2 rescuers. 2 and 4. Adult/child methods. 2 forceful for infant. 3. Single rescuer. 2 fingers, 30:2 ratio. Teaching point. Depth 1/3 AP diameter for CM. CliniqueRN Test-Day Tip. 1 rescuer infant equals 2 fingers, 30:2. Question 20. Poisoning acetaminophen. A 3-year-old ingested unknown acetaminophen amount 2 hours ago. Priority? 1. Give activated charcoal at home. 2. Administer N-acetylcysteine per protocol. 3. Wait for symptoms to develop. 4. Induce vomiting. The correct answer is 2. Administer N-acetylcysteine per protocol. Rationales. 1. Charcoal may be used early, but antidote is central. 2. NAC prevents hepatic injury, time critical. 3. Delays life-saving therapy. 4. Never induce vomiting. Teaching point. Get serum level at appropriate time post-ingestion. Follow nomogram. CliniqueRN Test-Day Tip. For Tylenol OD, think NAC early. Question 21. Diabetes, sick day rules. Which instruction is correct for a child with T1DM on sick days? 1. Skip insulin if not eating. 2. Check ketones and continue basal insulin. 3. Avoid fluids to prevent vomiting. 4. Double long-acting insulin dose. The correct answer is 2. Check ketones and continue basal insulin. Rationales. 1. Never skip insulin. Risk of DKA. 2. Right, monitor ketones, hydrate, continue insulin. 3. Encourage fluids. 4. Doses are individualized. Don't arbitrarily double. Teaching point. Call provider if moderate/large ketones or persistent vomiting. CliniqueRN Test-Day Tip. Sick day is not equal to stop insulin. Question 22. Febrile seizure. A 2-year-old has a generalized tonic-clonic seizure during a fever. Priority action? 1. Restrain to prevent injury. 2. Place in sideline position and protect airway. 3. Give aspirin. 4. Insert oral airway. The correct answer is 2. Place in sideline position and protect airway. Rationales. 1. Don't restrain. 2. The best option, recovery position, clear area. 3. Avoid aspirin in children, high risk. 4. Avoid putting objects in the mouth. Teaching point. Most are brief and benign. Focus on safety and fever control. CliniqueRN Test-Day Tip. Safety first, then antipyretics, acetaminophen/ibuprofen. Question 23. DKA, potassium. An adolescent with DKA is started on an insulin drip. Which lab requires the most vigilance? 1. Sodium. 2. Potassium. 3. Hemoglobin. 4. Calcium. The correct answer is 2. Potassium. Rationales. 1 and 4. Important, but K shifts are life-threatening. 2. Insulin drives K into cells, hypoglycemia risk arrhythmias. 3. Not the immediate danger. Teaching point. Replace K when indicated, monitor rhythm. CliniqueRN Test-Day Tip. In DKA, think fluids, insulin, K, and watch for cerebral edema. Question 24. Hirschsprung disease, nursing care. Newborn with failure to pass meconium and abdominal distension. Priority nursing action. 1. Rectal temperatures Q4H. 2. Measure abdominal girth and keep NPO. 3. Encourage frequent feedings. 4. Perform vigorous rectal stimulation. The correct answer is 2. Measure abdominal girth and keep NPO. Rationales. 1. Avoid rectal procedures, risk of perforation. 2. Best, monitor distension and prep for definitive management. 3. Feeding worsens distension. 4. Can precipitate perforation/enterocolitis. Teaching point: watch for enterocolitis, fever, explosive diarrhea, emergency. CliniqueRN Test-Day Tip: Hirschsprung equals no rectal temps. Question 25. Congenital hypothyroidism. Which finding supports congenital hypothyroidism in an infant? 1. Hyperactivity and diarrhea. 2. Tachycardia and weight loss. 3. Hypotonia, constipation, large tongue. 4. Early closure of fontanelles. The correct answer is 3. Hypotonia, constipation, large tongue. Rationales: 1 and 2. Hyperthyroid signs. 3. Classic: lethargy, poor feeding, macroglossia, constipation. 4. Delayed, not early, skeletal development. Teaching point: treat early with levothyroxine for normal brain development. CliniqueRN Test-Day Tip: mix levothyroxine with a small amount of water/breast milk. Never soy formula. Question 26. Vaccine schedule: 12 months. Which vaccine is due at 12 months for a healthy child? Northern Hemisphere. Routine schedule. 1. MMR. 2. DTP, 5th dose. 3. Rotavirus, final dose. 4. HPV. The correct answer is 1. MMR. Rationales: 1. Given at 12 to 15 months with varicella, HEPA. 2. DTAP number 5 is at 4 to 6 years. 3. Rotavirus series and by 8 months. 4. HPV starts at 9 to 12 years, often 11 to 12. Teaching point: live vaccines begin at 12 months for healthy kids. CliniqueRN Test-Day Tip: 12 months unlocks MMR/varicella/HEPA. Question 27. Pain scales. Best pain scale for a post-op 2-year-old? 1. Numeric rating scale, 0 to 10. 2. Flax scale. 3. Visual analog without faces. 4. Wong-Baker faces self-report. The correct answer is 2. Flax scale. Rationales: 1. Requires older child understanding. 2. Behavioral scale for nonverbal/young children. 3. Not developmentally appropriate. Faces typically range from 3 for years if able to self-report. Teaching point: choose a scale by developmental stage. CliniqueRN Test-Day Tip: toddler? Think FLAC. Question 28. Caustic ingestion. A toddler ingests a household alkali drain cleaner. First action: 1. Induce vomiting. 2. Give milk to neutralize. 3. Keep NPO and assess the airway. 4. Give activated charcoal. The correct answer is 3. Keep NPO and assess airway. Rationales: 1. Vomiting re-exposes the esophagus. 2. Neutralization causes exothermic injury. Avoid. 3. Airway first. Risk of edema/stridor. Urgent evaluation. 4. Charcoal doesn't bind caustics effectively. Teaching point: do not give anything by mouth until evaluated. CliniqueRN Test-Day Tip: caustic equals no neutralizers, no vomiting, protect airway. Question 29. Croup versus epiglottitis. Which finding is most consistent with viral croup? Laryngotracheobronchitis. 1. Abrupt high fever with drooling. 2. Barky cough with inspiratory stridor, worse at night. 3. Toxic appearance with tripod positioning. 4. Severe dysphagia without cough. The correct answer is 2. Barky cough with inspiratory stridor, worse at night. Rationales: 1, 2, and 3. Point to epiglottitis. 2. Classic croup picture. Usually mild fever. Respond to steroids/nebulized API if moderate severe. Teaching point: cool mist/steamy bathroom may help mild croup. CliniqueRN Test-Day Tip. Barky cough at night equals croup. Question 30. Burns, pediatric considerations. A 4-year-old with partial thickness burns on both anterior arms and anterior chest. Which initial order is priority? 1. Topical antibiotic now. 2. Isotonic fluid resuscitation and pain control. 3. High-calorie diet immediately. 4. Prophylactic broad-spectrum antibiotics. The correct answer is 2. Isotonic fluid resuscitation and pain control. Rationales. 1. Important but after ABCs and fluids. 2. Priority. Maintain perfusion. Treat pain early. 3. Nutrition matters later once stabilized. 4. Routine prophylactic antibiotics are not standard. Teaching point. Use Lund-Browder for pediatric TBSA. Monitor for hypothermia. CliniqueRN Test-Day Tip. Burns equals fluids first, then wound care. Great job finishing these 30 pediatric NCLEX questions. Party popper. For more practice, just click the link card above or the link in the description to get your free daily NCLEX test from our bank. And don't forget to like this video and subscribe so you never miss our next NCLEX practice set. See you soon, and happy studying.